So when I say in your best interest, that's a frame that people don't want to do things that aren't in their best interest. So that's just a small little nuance there. We can make this a little bit more clear, and we're going to make sure that you know exactly what's going on and everything. So that's how you kind of bridge into it. So that way it's like we figure it out. But a lot of times people have like one default answer. This is what we do for physical therapy, but we're maybe giving them an answer to not the actual question they have. It's they actually don't think physical therapy works. They've tried physical therapy before. They truly just don't know what physical therapy is. And so that's why it's so important to know why we're actually have the answers that we have, why we ask the questions that we have, because if we don't really understand what is a qualified good answer, it's very easy for us to move on and then later on wonder why people are no showing and not showing up and canceling and all this stuff, despite you're like, I feel like that was a good conversation. And so we have to really dig into this type of stuff, because this is where we can change lives. A common thing that we hear in a lot of the in-network clinics that we're working in is someone calls in and they're like, I need physical therapy because my doctor told me that I need it, but I don't really know why. And normally we kind of give a half-baked answer. We don't really hit a lot of this type of stuff. And then what ends up happening is that person ends up not showing up for their eval. And we wonder why. They're like, it was a referral, the physician, like maybe the physician doesn't actually like pre-frame them enough. There's something going on. And really we're like, okay, this should be a slam dunk. It's very easy. There's still a referral. So we don't maybe put as much effort into this one. But this one I can pretty much guarantee you is costing thousands of dollars from a lot of in-network clinics around the nation. And so I'm Dr. Joey Albritton. I work with rehab CEOs. We're working with about 275 clinics around the nation, ranging from cash, hybrid, and network. And so we see these all the time, especially when we have people that have good physician relationships and everything like that. But it's either the doctor is really busy, so they don't really explain what physical therapy is, or the thing that we really need to be aware of is a lot of doctors are going to be referring to physical therapy for 2 times a week for 4 weeks because their clinical prediction rules require them to actually do that to then be able to justify surgery for the insurance companies to cover it. And so that's the thing we need to be hyper aware of, is because depending on how this is kind of happening, we'll know kind of why they're doing it, or we'll see trends that Dr. So-and-so literally always has people referred to us, but they have no clue what the heck physical therapy is. And so we need to kind of conquer that. And so what we need to do is actually acknowledge the fact that they don't know what physical therapy is, that it can be a little bit confusing, but this is common and that it's not a them issue. And so the way we do that is we tell them, it's like, hey, I understand it can be a little bit confusing to be referred for physical therapy and not really understand why, or even maybe what physical therapy is. But just so I have a better idea, I mean, I guess for you, what is your inherent knowledge of even what physical therapy is and how it could potentially help you? So then at that point, you're going to either figure out, oh, they've had physical therapy before, and that person is actually someone who's anti-physical therapy because maybe it didn't work in the past. Or there's someone who is diehard, I need surgery, and they just don't really inherently think physical therapy even is an option. So we need to kind of overcome that objection. Or the other one is that they just don't even know what physical therapy is. There's a lot of people in the public that don't know what physical therapy is, or they associate it with like, hey, I get in a wreck, I need to learn how to walk again. And that's pretty much all physical therapy is, versus like, hey, I have shoulder pain. And so we need to kind of figure out where they are on those things, because there's not really always necessarily a net like negative tone here. It could just be neutral. It could be negative. It could just be like the person didn't tell them much, so they don't know. And so we want to acknowledge that it's okay. We talked to a lot of people like this before, that this is not uncommon for you to not inherently do that. And so depending on what they say, if there's someone who comes in and they're going to be saying like, oh, well, like, I don't think physical therapy could work because I tried it before, we need to get context on, is it physical therapy for the same thing? Is it physical therapy for another condition? What does that look like? Sometimes it's a significant other that's tried physical therapy. So we just need to have better context. If it's them, really what we got to do, it's like, hey, totally get that. Every physical therapy clinic's a little bit different, and even conditions are a little bit different as well. Just so I have a better idea, what is it that you did like about the physical therapy clinic that you did go to? What do you feel like was helpful? And so they're going to then start selling themselves on why physical therapy was good, instead of just saying like, why didn't you like it? And then they're saying, I hate this, I hate this, I hate this, I hate this. And we now have to flip that on the other side. We want them to say, I like this, I like this, I like this. And then you can say, oh, okay, totally get it. And so for those, like you really want this, like that's pretty common. But I guess if we could make this kind of like the unicorn physical physical therapy kind of option for actually fixing everything that we're talking about. I guess what is it that maybe you wish they had maybe done better? And then they'll tell you all the things that were important, the things they didn't like. So then when we start talking about how you're different, it's all the positive things that they inherently said they liked. We conveniently don't do any of the things that they really said are an emphasis. Of course, don't lie. Like, make sure that you're actually saying stuff that is legitimate. But like, maybe someone's like, oh, well, like, I just didn't want to really do a lot of like dry needling, and they wanted me to do dry needling. And you're like, cool, well, we definitely don't need to stick you with needles there. So you don't bring any of that type stuff up, where you maybe would have brought some of that up, which you still shouldn't anyways, but you maybe won't bring that up because you'll know that. Or you'll know that like they were complaining because they had text. They were complaining because continuity of care. They were complaining for a multitude of reasons, but we can frame it to figure out what did they like, what did they not like. So now it seems like a customized plan that's inherently different than everything else that they've tried. The other option is maybe they actually do want surgery, and we actually need to figure out like why that's the case. It's like, hey, for you, I guess, and depending on there, like for most people, if they have surgery, it's like knowing that after surgery that most people are going to be sent to physical therapy on the back end. I guess for you, is there a reason that maybe you'd want to go through that if we could potentially actually just skip the middleman, save you some money, not have to hit your deductible? And they'll be like, I didn't know that was an option. So then we can kind of talk to them a little bit more. And then there's the person that knows nothing about physical therapy. We can actually kind of walk them through there. It's like, well, physical therapy is often prescribed because it's highly effective, non-invasive, and we're able to manage a lot of treatments, specifically shoulder pain that you're kind of having. And that means your doctor probably saw, based on what they're seeing there, that you'd be a really good fit for this. And so based on what I'm hearing from you and based on what your doctor's hearing, it sounds like this is really the best option and really would be in your best interest for us to actually kind of look at that so we can customize everything. So when I say in your best interest, that's a frame that people don't want to do things that aren't in their best interest. So that's just a small little nuance there. We can make this a little bit more clear, and we're going to make sure that you know exactly what's going on and everything. Our goal is to get you back to being your best self, blah, 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 whatever potential things that you actually got from the start of the call of the main goal that they're wanting to do. Is this something that you'd actually want to kind of be hearing a little bit more about and want to actually go ahead and get scheduled for? So that's how you kind of bridge into it. So that way it's like we figure it out. But a lot of times people have like one default answer. This is what we do for physical therapy, but we're maybe giving them an answer to not the actual question they have. It's they actually don't think physical therapy works. They've tried physical therapy before. They truly just don't know what physical therapy is. And so that's why it's so important to know why we're actually have the answers that we have, why we ask the questions that we have, because if we don't really understand what is a qualified good answer, it's very easy for us to move on and then later on wonder why people are no showing and not showing up and canceling and all this stuff, despite you're like, I feel like that was a good conversation. And so we have to really dig into this type of stuff, because this is where we can change lives. This is where we can finally get people to make the decision that we know is best for them. And this is how we can really start to make more money for a clinic. And so if this was helpful, we've got a lot more sales training just like this on the channel that you're on, but also inside school, we've actually made it all very easy for you to go through with all of our sales training for front office, for providers, everything like that, 100% free. And if you're like, hey, I'd actually like to have this a little bit more customized to me, we do 2 free group coaching calls a week in there too. So you can hop on there, ask me, ask Robbie. That way we can customize it based on where you're getting objections, whether that's your front office or your provider. We can help you on all those type things. So if you enjoyed it, hope to see you on the next one and hope to see you inside school. Bye.